Guest District Governor Ben Hoover.
Thank you. Dr. Kevin Moser received his BA summa cum laude with distinction in biochemistry from the University of Pennsylvania and his MD from the University of Pennsylvania School of Medicine, our nation's first and still finest medical school. In 1979, he came to York Hospital as a family practice resident. He was then a partner at Dallastown Family Practice from 1982 to 1990, before returning to York Hospital as Associate Director of the Family Practice Residency. From 1995 to 2003, Kevin was the Medical Director of the Wellspan Medical Group, during which time it grew from less than 50 physicians to 150 providers with 500 employees and more than 50 practice sites. In 2004, he was named Senior Vice President of Wellspan Health and President of Gettysburg Hospital. In 2010, Executive Vice President and COO, and last fall, President and CEO. I've known Kevin since he was a resident. He and Carolyn have been married 33 years, and they have two sons, Jonathan, a pediatric resident in Seattle, and Ryan, who works for the Chilean National Volunteer Program through the United Nations Development Corporation, operating a program called English Open Stores in Santiago, Chile. Kevin is an elder of First Presbyterian Church, where we have served on the session. He was a Rotarian while in Gettysburg, and from 1995 to 2003, he was my boss. During those years, I never had a written contract. Kevin and I met annually, agreed on salary and incentives, and simply shook hands. I'm very proud to present to you the first physician to be president and CEO of Wellspan Health, Kevin Moser. Kevin?
Thanks. It's a real privilege to have the opportunity to come and address the Rotary Club here. This club was actually instrumental in my development as a physician. You might wonder how that happened. Well, when I was a young intern with pretty long hair and a Fu Manchu mustache, in 1979, my internal medicine rotation consisted of making an attempt, and I use that word intentionally, to follow Ben Hoover around the rounds and learn the craft from the master, actually. And for those of you who know Ben and the way that he took care of his patients, I was very closely supervised in everything I did, except for 2 hours a week. And I could count on Ben to come to Rotary, and I could do anything I wanted to. And so my thanks. I'm going to try to take you, my purpose today is to give you an idea of Wellspan Health, because we are a really different organization than some years ago. We are kind of transforming almost daily. And to give you an idea of our regional scope and who we are, and then to give you some updates on things happening in this community in our York market going forward. So it is important to realize that Wellspan, interestingly enough, has become a regional provider of care in several different ways. Our geography now spans from Adams County in terms of our defined service areas through York County and into northern and eastern Lancaster County with the October merger that we accomplished with Ephrata Community Hospital, which is a wonderful community hospital serving a really interesting population in that part of Lancaster County. And just a couple of months ago, we signed a memorandum of understanding and are currently going through due diligence to add a Good Samaritan Hospital in Lebanon County to our organization. And that is likely, if it happens, we have a long ways to go yet, but we would probably consummate that relationship around January of next year. So our organization, due to the climate in healthcare and the reimbursement mechanisms and the imperatives on us to begin transforming the way we provide care, is growing rather rapidly. We also consider ourselves to be an integrated health system, and that what we attempt to do at Wellspan is attempt to take the array of services that people require over their lifetime and somehow stitch them together so that they work more efficiently together and they're easier to use. Now, that's an aspiration of ours, and many of you, I'm sure, have used our services and find that we're not exactly at that goal yet, but I think we get closer by the day. And our dream is to have a system that is really easy for people to use and very efficient in that use going forward. So what do we look like? Well, we have a medical group that employs over 700 providers, over 550 physicians. About 2/3 of that consists of specialty care providers, and about 1/3 of that is in primary care. We operate over 100 sites, so what we consider to be access points of care around our communities. We employ more than 11,000 people in Wellspan and operate 4 hospitals with a total bed size of more than 800 beds around our service area, and generate about somewhere between $1.5 and $1.6 billion of revenue a year, which makes us the largest healthcare provider in South Central Pennsylvania. So Wellspan Health, by revenue and employees, etc., for example, we are larger than Hershey Medical Center. We're a larger organization than most that you hear in this area, with probably the exception of Geisinger. So we've become a pretty large organization, but what's interesting about us compared to many healthcare organizations is that only about 30% of our revenue is derived from inpatient care. So while we emerged from our Operation New York Hospital, we've really transformed into a system that provides the vast majority of our services outside the walls of a hospital setting. And we are relatively unique in that structure in healthcare today. We do roughly $175 million a year in uncompensated and charitable care. Wellspan Health in this market, and in actually all of our markets, is typically the predominant provider of services for medical assistance. And we run a number of community programs that we're very proud of to support those who can't pay. Some of you may have heard of our Healthy York Network, our Healthy Community Pharmacy, the York Community Health Center. And we run those programs in essentially all of our service areas. We have maintained our financial strength. We just had our bond rating reaffirmed, thank goodness, and that seems to be going all right. But more than just our own configuration of services throughout our service area, we've also expanded into being more regional provider of care through our physician group. So as a simple example, our neurologists, as of today, if someone arrives at Chambersburg Hospital with a stroke, we use basically an electronic Skype on steroids, so to speak, to connect to one of our neurology specialists in stroke in York, and they guide that care at Chambersburg Hospital if necessary, if they require the types of high-level services that we provide here, such as acute intervention for their stroke. We transport them here and take care of them here in a very smooth fashion. We provide high-risk perinatal services in Franklin County and in northern Lancaster County, and Wellspan physicians provide all of the open heart surgery at Good Samaritan Hospital in Lebanon as of today. So I could go on with those examples, but through our very substantial physician services, we've been able to project our services throughout the region, I think in a very effective manner. And just to be sure that everybody's aware, we are a nonprofit organization. We're a 501(c)(3) tax-exempt organization, but what I want to assure everyone here, because it's important in this day and age, is that the only place that we use our tax exemption as an organization is with our hospital campuses. So there are other 100+ sites of care. We are a taxpayer and pay those taxes gladly and contribute to our community, and it really is a substantial amount. But we pride ourselves in our nonprofit status and take our commitment to the community in terms of providing care to all who require it extremely seriously. So with that, I'm going to give you a little bit of a tour around what's happening in New York, because in an organization our size, we go to each of the markets that we serve. I think it's important to have people kind of in the know of what's happening. So what's going on lately? Well, a few months ago, we opened a new practice site on Roosevelt Avenue. Most people recognize it as the site of the former Damon's. I never got so much criticism in my life as when we purchased and tore down Damon's. I don't know why it went out of business. Everybody seemed to care about it. After months and months of debate within our organization, we decided not to acquire the liquor license. But I assure you, as president of York Hospital, Keith Knoll has some of the most creative ideas about that liquor license. That practice is really a kind of an amazing phenomenon for us. We had two young doctors who were graduating from our family practice residency, Quincy Harburger and Brandon Dearman. And they have kind of a vision of how they want to provide health care in this new world that we talk about, where insurance partnerships are very different, government partnerships are very different. And they took the bull by the horn, and we decided to invest in them by creating this practice out on Roosevelt Avenue. And these young men are really going great guns. So to give you a general idea, this is kind of hard to absorb if you're not a physician, because seeing new patients takes a lot of time. So in their first 2.5 months of operation, they had 700 new patients come to that practice. Which kind of shows you the general need for primary care in that part of the community. And they continue to grow at a pace of more than around 250 patients a month. Now that takes a lot of time when you figure that every new patient requires you about an hour to see, and you still have to see the follow-up from that first visit. So they are going great guns. They're open every day of the week, and really just doing a fine job for us, and we're really excited about creating that new access point of care. Again, I have a problem all the time in which I date myself unintentionally, because I've been around this community so long. But for those of you who remember where Shaw Oldsmobile used to be, down near Queensgate Shopping Center off of Queen Street, we have just completed a new building. It's about 28,000 square feet, and it's a new concept for us. And this building is designed to house both obstetrics and gynecology and pediatrics. And our idea is that by synthesizing those two locations, we hopefully can make care more convenient and bring some of their mutual operations together and add some services to the site that will be beneficial to people who utilize it. So we have an education room in that building. We have some specific space for moms to breastfeed that both our postpartum checks and our new pediatric patients can utilize. We've done a lot of interesting things with the style of the building, and we are moved in and ready to go, and very proud of that investment, which is pretty significant in the community. About almost 2 years ago, not quite 2 years ago, we brought to life our new surgical and rehabilitation hospital on the Apple Hill campus. And that facility has been really our pride and joy as an organization. It is designed, if any of you have not been inside it, you're certainly welcome to contact myself or Keith. We'll be happy to arrange for you to look at it. It really is specifically designed on one side for the needs of patients with very difficult rehabilitation needs. We brought a brain injury unit, a very high caliber, into the community through that operation, and the whole space is designed for the rehabilitation, modern rehabilitation of the patient. And our surgical hospital, which is also in that building, is also designed specifically for the needs of that population. And that building has been very gratifying for us to see, because there was a great need, I think, for additional rehab beds in the community, and we have been full on the rehab side since day one. Our surgical volumes have been growing very nicely, and it's become an extremely busy place, something we're extraordinarily proud of. And the final thing in the York market I want to talk about a little bit, and perhaps more extensively, is our emergency department project. So for those of you who have been in our emergency department at York Hospital, hopefully your care has been excellent, but you would agree that the facility, which was designed, this is so hard for me to believe, we called it the Century Project. Remember that then? Because it was supposed to take us into the next century, and I keep thinking that was only a few months ago. But the turn of the century was actually a long, long time ago. I still have Y2K ringing in my head. The York Hospital Emergency Department is really in need of a refresh and a change. Part of our challenge is that it is, well, actually part of Keith's challenge, because he's responsible for it, is that it's kind of landlocked, and we don't really have a place. In our Gettysburg facility, we were able to build a new emergency department by going out away from the building. And in our Ephrata hospital, we just completed a new emergency department, which also went out from the building. We don't have that space in York, so we're essentially going to have to expand and renovate the emergency department on-site, partly while we're seeing patients. So it'll be a challenging project that makes it a little more expensive. Right now, the project cost stands at about $48 million, and it will take about 2.5 years. We hope to start it in August, take about 2.5 years. But when we get it done, it will be well worth it. We end up with 50 beds. We will eliminate hallway beds and move to private rooms so that we have a much higher level of privacy with a much better flow. We have built into the plan designated pediatric rooms, designated behavioral health rooms, which is a real need in our community, and a designated, a lot of different terms for it, acute care, fast care area for people who come in with things that turn out to not require a prolonged stay, so we can move those less acute patients through the emergency department with much more efficiency and rapidity. We'll be upgrading. We have something like 6 resuscitation rooms. You may know that we are a level 1 trauma center, which is the highest level trauma center and one of the most highly respected trauma centers in the state. And this will help upgrade and continue our growth in trauma services as well. So I mentioned that it's a $48 million project, and it's budgeted at $45 million. So we have a very generous gift from our own auxiliary towards closing that gap, because we want to do some of these special things that account for the last $3 million. So you may be hearing from us at some point about potential support for that emergency department. It's a long project, 2.5 years, and so in advance, I believe I have a lot of faith in our team in that emergency department, and I think they will do everything to keep things flowing. We apologize in advance if it takes a little bit of time, as the road signs say, temporary inconvenience and permanent upgrade, and I think we'll be able to give this community one of the best and most efficient emergency departments that is seen around. And so that's a kind of quick walkthrough of our activity in the community. What are some unique challenges we face today? Well, I'm not going to go into healthcare reform. I would need about 20 hours to do that. But in short, we are needing to transform our services into maintaining health, and to optimizing our community health, and to prevention and a wide variety of other services, because we know at Wellspan that healthcare today is simply too expensive. It's driven by high utilization of services, it's driven by price, and we feel absolutely dedicated to driving down the cost of healthcare so that we can have a vibrant economy in the community. So we recognize that. We are actually investing. I was talking to Better York, and one of the funny things about healthcare is we are investing millions of dollars to drive down the utilization of our own services, which is a strange place to be, trust me. So we are investing in making our revenue go down. We're doing that through patient-centered medical homes, which is a whole new healthcare construct in primary care. We just received news that we had 16 of our practices certified at the highest level of patient-centered medical homes. We're doing that through technology. So we were just notified that we are now a HIMSS level 6 system at 3 of our 4 hospitals. Ephrata obviously is too new to our system for us to have converted yet. HIMSS Level 6 is a measure of how you apply your technology to patient care. And I'm really proud to say that only 12% of all hospitals in the United States are HIMSS Level 6, and we have 3 of them in Wellspan. So that's a real tribute to the investment in our technology. But technology is an ongoing challenge for us. Reforming our care is an ongoing challenge for us. Maintaining our costs so that you get the best possible care that you can in this community at an affordable price is going to be an ongoing challenge for us. Most of all, I thank you for those of you who have used our services. We thank you for trusting us. We take that very seriously, and we thank you for allowing us to be a part of this community and provide healthcare services to you. And I'm willing to answer any question that you might have. Yes, sir.
In this day and age, in terms of costs of healthcare, what will Wellspan do to help consumers know their costs before they experience them, when they can?
The question, for those who didn't hear it, is what will we do to help our patients know the cost of their procedure or whatever services they're having before they have it? And that is a great question. One of the things that we struggle with on a regular basis is how to predict the cost. It sounds kind of strange because you think if I'm going to walk into the grocery store, somebody ought to be able to tell me how much ham costs per pound. And unfortunately, it's a little more complicated than that. To actually give people the true cost of their procedure, we need to know how they're going to pay, what their insurance company covers, what our agreements are with the particular insurance coverage, and that's been a struggle for us. We are, however, through our billing department, always happy to help anybody who wants to know the cost of their procedure. And if all else fails, call me, and I'll make sure that you know how much it's going to cost before you get it. It's very complicated, and it's one of the things I think that is really screwed up about healthcare today. And that is that everybody's pricing is different, everybody's contract is different, there's tremendous cross-subsidization, and it's not transparent enough. And it needs to be more transparent because more and more people are under high deductible plans and have out-of-pocket expenses for what they're going to incur. So that's not the most satisfactory answer to your question, sir. I understand that, but it's something we take very seriously and we're working really hard on. Yes, ma'am.
Thank you for what you talked about in terms of some of the innovations that Wellspan is doing. Healthcare reform is supposed to open up access to healthcare for millions of additional people. And there's been a lot of talk about the lack of capacity to meet the needs of those people. How well do you think Wellspan now is positioned to deal with however many uninsured there are in our community and the number of people that will try to access care more through primary care than through emergency departments?
Well, we're hoping that we are adequately positioned. And it's one of the reasons why we continue to add capacity to our organization in terms of our physician base. So while we have not added a lot of capacity to our inpatient care, quite honestly, we have the same number of beds at York Hospital and all of our hospitals that we had some years ago, because you may not know this, but across the country, inpatient bed utilization has dropped about 8% across the country. Because of the growth of York County, we're kind of flat, but all of the innovations in healthcare are really driving down utilization of beds, but then driving that capacity out to the physician base. So last year, I should have brought this number. Last year, we recruited 102 providers to our service area, about 80 of them to York. We try to add capacity in primary care every year. So if I went back, I'd have to track it, but we added our Roosevelt practice. They have the capacity, that's about 4,000 patients worth of capacity in that one practice. A couple of years ago, we grew our Wheatland practice in the north. We just added to our Dover practice. We've expanded almost everywhere we can. So we think that we have, as best as we can project, we think we have adequate physician capacity to absorb whoever comes into the healthcare market. That said, one of the advantages we have in that planning is that, to be perfectly honest, for those who have attempted to access care in that uninsured and underinsured population, pretty much we take care of most of those patients, to be honest, anyway. And so we know a lot of who they are, and a lot of our challenge is trying to help them navigate from their current status. We have a program called Healthy York Network, where we essentially provide a card to people who are under or uninsured that allows them to navigate the healthcare system with some dignity, and also allows us to help them utilize their services efficiently. And trying to figure out how to help those people convert from not being insured to being insured. We take being insured for granted, but not everybody is as facile with the navigating the insurance world. And so it's been an interesting adventure in helping people navigate the exchange and get insurance, and then figure out how they're going to cope with their deductible. And so it is really complicated right now. But the short answer to your question is, I'm really confident that we have adequate capacity to absorb whatever comes into the system from the uninsured ranks to healthcare reform. We've been planning that for a number of years.
Could I ask a follow-up too, just
Sure.
in terms of cultural competency and the diversity in our community, not only in terms of race but ethnicity, and people moving here from around the world? How are you planning to deal with that competency need in our counties?
Sure. Well, what's really interesting is that it really depends. I have to say this. It depends a little bit on what part of the organization you are in. So I would say, I think with some accuracy, that perhaps the most culturally diverse part of our organization is our physician network. In recruiting physicians, because medical schools have become very diverse because of the number of cultures that come into them, we have hired physicians from almost every cultural part of the world, and it's given us a pretty nice, diverse, and rich physician base. Our employee base comes pretty much from New York County, so that's where we have to do a lot of diversity training. So we have a really very aggressive diversity program that we put people through training. I happen to be trained, although Karen will tell you I'm not any more sensitive than I used to be. Culturally more sensitive than I used to be. And then we have there's an interesting twist that we are now adapting to, and you may not think of this in the cultural sense, but it really is. And that is with our acquisition of Ephrata Community Hospital. We serve a tremendously high percentage of the Plain community in northern Lancaster County. And now at York Hospital, as we build services in Ephrata, we see more of the Plain community accessing services at York, and we've had to ramp up. So we just had an interesting case of a member of the Plain community from northern Lancaster County who came to York Hospital with a pregnancy issue. And we actually brought one of our navigators. We have navigators in Ephrata who help them navigate the system because of the cultural similarities. And the navigator came from Ephrata down to York Hospital, trained the staff responded, and we have gotten really nice feedback from the Plain community that it was a highly positive experience. I give Keith and his team a lot of credit for that. So we're not only dealing with international cultural type of diversity, and then we have to deal, lastly I'll just mention, we have to deal with generational diversity. So, you know, I go into a bank if somebody gives me a check, because I like to know that thing is in the bank and have somebody hand me cash. My son gets his cell phone out and takes a picture of it and hands it to me and says, "You probably want to shred that, Dad." He hasn't seen the inside of a bank in a long time. He's a member of the millennial generation. And so we're struggling right now culturally as millennials come into the healthcare requirements, pregnancies, etc. How do we meet the needs of a generation that's grown up in a very different style of communication? So you put your finger on a huge issue for us as an organization that we work on. Great point.
Recognizing that mental health services are typically a loss of revenue loser, and also there's a great need for mental health. In this area, where is Wellspan kind of expanding on that? Currently, wait time for an adolescent psychiatric appointment is about 4 months to get an adolescent or referral back into an inpatient placement, even if they had been there previously, but they haven't been there in a year. where you're definitely going to lose revenue, but there's a huge amount of service needed?
Sure, that's a great question. We operate actually, really well known, we operate one of the largest behavioral health operations, certainly in the state of any healthcare system. We spend somewhere between $10 and $20 million a year of loss. It's a sad statement that to provide those services, we absorb somewhere between $10 and $20 million a year of loss, cost versus revenue. And we have attempted to continue to expand it, but on one front, which is psychiatry, we've been stymied by the lack of psychiatrists available. And we've had a very difficult time recruiting psychiatrists to not only this market, but that's just nationally. Not very many physicians are choosing psychiatry as a career. The field has changed a lot. So we have further developed our cadre of therapists, and we have started a residency program in order to bring more psychologists into our area to train. We're running a really extensive intern program in order to increase our number of providers. But I have to be perfectly honest, the demand, no matter what we do, it's hard to describe the demand and need for behavioral health services. And what we find, we have an interesting program called Bridges to Health, where we identify people who utilize very high levels of healthcare services at very high expense, and surround them with a program that enables them to decrease their utilization of healthcare services. The number one issue in people with extraordinarily high healthcare expenses, the fact that their behavioral health issues are not managed. So as a society, we are undercompensating for behavioral health, underinvesting in it, and literally paying 5 times that by having people who are without treatment overutilize healthcare services such as the emergency room, etc. It is an insane way to run a healthcare system. So we're working at it, we're recruiting, we're trying to recruit as many as we can, we're trying to build as much capacity as we can. Even though it really hurts financially, it's part of our community mission. But I don't think we will ever be able to meet the need. It seems to be insatiable in today's environment. Yes, sir.
First of all, Healthy York Network is fantastic, and I don't know how many people in here know about it, but it does a great job taking care of the most vulnerable amongst us. Early on, you commented about having given out $175 million in affordable care, and of course, ideally, with the Affordable Care Act, that number is going to plummet. I just would like to have a comment on where you project that charitable giving number to go.
Well, we don't know. And what we're struggling with today is trying to figure out where that endpoint is. So, for example, if you're, just a couple of vignettes that we've had through our Healthy York Network activities. So we have one woman that we work with as a simple example. Her husband is employed and has insurance. They don't have a really high income, but he has insurance, but his employer doesn't cover her, doesn't offer family coverage. So she is uninsured, but when she went on the exchange, it turns out that the subsidy only applies to your family income. So the family income was too high for care on the exchange, but they really don't have enough resources to get insurance, and so she will likely stay uninsured. So we have to stand ready to help her. We also, most of the plans on the exchange, as you may know, particularly silver plans, which is what you need for subsidy, contain pretty high deductibles and co-pays. Not for every service, because some services are mandated. But the issue still comes up that if you have a family income at 133% of federal poverty guidelines, where do you get the money for the $2,000 copay? And so we're trying to figure out how Healthy New York Network applies almost as a secondary insurer in that market so that people don't go through the collection agencies and everything else with bad debt. And then, of course, in Pennsylvania, we have the gap caused by the lack of Medicaid expansion. And so we have a big hole in coverage that doesn't look like, at least at this moment. Hopefully, the governor's plan will be accepted, but we're at risk for still continuing to have a pretty high need. So through deductibles, and then again, it's it's difficult to not make the mistake of thinking that everybody understands how to navigate the healthcare system as we do. And so even with all of that subsidization, it's an interesting fact that about 25% of people who signed up on the exchange, so when you sign up on the exchange, you really don't have insurance until you pay your first premium. About 25 to 30% of people, as of a couple of weeks ago, we'll see what happens through the end, who signed up and navigated the exchange for the insurance didn't pay their first premium. And therefore, even though they're counted as people who signed up on the exchange, they never got insurance, because when it came time to pay their first premium, even with the subsidy, they had other pressing household bills and couldn't pay that premium. So to be really honest, we're really up in the air, and all we can do is kind of stand by and wait and see what happens. I personally am not optimistic that our obligation to provide charitable care and stand by the community in that sense is going to go away by any stretch. It might lessen somewhat, but I don't think it will go away. Absolutely. Thank you.